Hello everyone, it's Terry,
I'm Katie.
and in this video we're going to talk about the oncology appointment that we had about Katie's breast cancer. Before we get a little bit further into the oncology appointment, we're going to talk and say what kind of breast cancer that Katie actually has, because it's important. We found out that there's many kinds of breast cancer, I think up to 15 different types of breast cancer, and Katie's is a grade 3, which is the fastest growing. Turns out it's also a triple negative, which means that it's negative for estrogen, progesterone, and then the HER2, which is a rare type of cancer and most found in younger women, which Katie's only 28, so I guess it's more common for the younger women. So that's what she has, a triple negative, and that's why we started out with an oncology appointment to kind of get moving fast and quickly. And I guess now, Katie, before we went to the oncology appointment, what was your biggest fears, or what kind of questions did you have?
I had a lot of questions about what treatment I would be receiving and in what order. Brenda told me that I would likely receive chemo prior to surgery, and most older patients receive surgery before chemo. I was concerned about how I was going to change my life so that the cancer doesn't rule my life, but rather just fits into it and becomes my new normal. And luckily, one of the first questions that my oncologist asked me was if I have children and if I want children. We don't have any kids right now, but it's something that we would like for our future. So our next step is going to be to see a fertility doctor.
And that was very calming for us to be the first question out of our mouth. It wasn't about the chemo, it wasn't about what our path was going to be. It was to make sure that we're going to move on and have a future, right? Move on and our life in the future. She's already planned for our future before we even start fighting this cancer. And just like all of Katie's family, they're very organized. So we actually took her little sister Jules along with us on this video, or on this appointment. And of course, we have a little binder, and she had a notebook with her, and she wrote down all of her notes for us as Katie and I sat there and listened. And the doctor told us that it's going to be depending on a lot of different things about the chemo, but because it is the grade 3 fast moving cancer, very I guess aggressive cancer that Katie has, that we need to move fast, move quickly, get to the fertility doctor. She recommended a great doctor for us to go see. So we got that in line, and then she started talking about the chemo, getting the port in, and that chemo should start within the month or quick, as soon as possible. As soon as we get fertility, she's really concerned about our fertility, getting that all up to date and getting that ready to go. Make sure that we are ready to move forward and have the fertility thing all out of the way before we start chemo, which is very comforting. And the biggest thing that I took from the oncology appointment was she looked at us both and said that we're going for the cure. She was very confident and knew that we're going to get through this, and just do her best to help us get through this and get the chemo started as soon as possible so we can fight this and get it over with. Anything to add or that you remember from our oncology appointment? Well, we have many more appointments to go, and if there's anything else that we have to add, we still have more oncology appointments to do before we even start the chemo. Report has to come in, everything like that. So those appointments will come. We'll keep updating. We'll keep telling you more and adding to this journey. And hope you enjoy and hope you keep watching. And hope it helps those people out there that helps, because I know we had a lot of questions, and I feel like us making a video to answer some questions and let people know what we go through will be a good way to help answer questions and see what other people have to go through. Thank you for watching.
Bye.